What about pain? It seems like getting dental implants would be painful.
You know, I hear that question every week as well. Pain is one of those things where everyone, feels it or experiences it differently. Most of the patients that go through types of procedures, really Advil is enough. Tylenol is enough. Over-the-counter medications are enough. And there's a lot of patients that come back that are pleasantly surprised and say, Doc, that's it? I can't believe it. So in general—
I told you, my father, it didn't hurt at all, he said.
Yeah, and especially if we're doing things like guided surgery, minimally invasive surgery, using lasers and using other treatment modalities, that we're not going in and being as aggressive as previously, or maybe they are in other clinics at times. We were able to do things much more precise, much more accurate, and minimally invasive, which reduces your pain quite a bit. And that's important, especially when we're doing fixed teeth. If we give you fixed teeth in one day, they're not touching the gums. They're not pushing on those gums that day, so you're not feeling that pain as much. And that's a big deal. You're getting a very good result with very little pain.
Okay, so leading up to the day, right? Sedation. Are you giving them a pill? Are you giving them an IV? What are you doing on the day of the procedure?
So we have varying different options for sedation in the office. Anything from oral sedation, IV sedation. We're able to provide those services for our patients. It's really up to them. It's funny. Even though we're able to provide those services for them, so many of them go without sedation. And the reason, and I would say the majority of the cases that I do, patients opt to go without sedation, and they do just fine. They do amazing, actually, because they want to be able to look at things when they're done and see. But when they have sedation, of course,
do they get amnesia a little bit?
Yes, they forget.
Like they don't even remember the procedure?
Well, there's a couple times where they call the next day asking if they missed their appointment, and they've got teeth in their mouth. So
they forgot that they were there.
Yeah, so it is possible for people to forget and to have amnesia after it and forget about the procedure altogether, and that's normal.
The fear of pain is definitely not a valid excuse for not getting this done.
No, it's definitely not a valid excuse. As soon as I'm not going to feel a thing. Seriously. It's one of those things where it's such a procedure that's so routine now in our office. We do so much of it. And it's something that we're able to do with technology and very precisely, that's so minimally invasive, that really pain is not an issue.